You are listening to Vaccine Voices, an educational series presented by the IPRO QIN-QIO.
Welcome to the fourth installment in our series on applying motivational interviewing, or MI, in long-term care settings. My name is Jeff Weatherhold, and I'm the host for this series. I am a motivational interviewing trainer and coach, and the principal at MI for Health. Motivational interviewing is an evidence-driven approach to support individuals in moving toward positive behavior changes. MI practitioners seek to identify and strengthen an individual's own reasons for change, their intrinsic motivation, while addressing the obstacles and challenges that make it hard for them to change. We hope this series will help you incorporate MI into your own practice. In this series, we're going to cover a range of cases that represent realistic depictions of different forms of vaccine resistance in long-term care settings. For each of these, the interviewer will be a director of nursing within a long-term care organization. The interviewees will be different each time and will reflect the diversity of backgrounds, roles, and perspectives that we encounter in long-term care. You can find more information on motivational interviewing and this series by clicking on the Wave button at qi.ipro.org or by visiting miforhealth.com. For today's case, we'll be speaking with Monica, the daughter of a resident in the adult long-term care facility where you work. Monica is authorized to make health decisions on behalf of her mother, who is one of the residents in your facility. Monica seemed reluctant to engage with you in previous attempts to have a conversation, but is willing to speak with you in your office today. It will become clear early in this conversation that Monica has deep feelings of mistrust that stem from the mistreatment of marginalized communities by the healthcare system. This scenario will provide us with an opportunity to practice acknowledging and working through feelings of mistrust, to have productive and supportive conversations about change.
Monica, I am really happy that we have the chance to talk today. Thanks for taking a few minutes.
You're welcome.
Your mother seems to have adjusted well since she arrived here earlier this year. How are you feeling about her health?
I think she is doing as well as she can. I wish we could still care for her at home. That's not possible. So we appreciate the care that you all are able to provide.
Thank you. It means a lot to be trusted with her care. As part of our care planning, I wanted to make sure that you and I have the chance to discuss vaccination for COVID-19 for your mother.
Yes, I was afraid that might come up.
You have concerns about the vaccine?
I do, and my mother has done just fine so far without it.
You have already put some thought into vaccination for her.
I have. We have talked about it as a family. How can we not? COVID has been everywhere for the past few years. I know that you all want everyone to take the vaccine.
We do recommend that all residents get vaccinated against COVID-19. There is a higher risk for transmission in an environment like this, and many of the residents here are more likely to develop severe symptoms if they get COVID-19.
Everyone is working hard to push these on us. That's been the case from day one. I will never forget how quickly the clinics appeared in our neighborhood and how hard folks worked to get us to take something that they barely understood.
You are concerned by the speed with which the vaccines were developed and what we knew about them early on.
Yes, I am. And by how familiar all this looks, not much has changed.
You have concerns about other vaccines as well.
I suppose. I have concerns about the whole process, the way these things get developed and rolled out, and to who. It's very interesting to me that these shots were developed in a few weeks and that they haven't really changed all that much in the years since. That certainly feels opportunistic.
I can understand how those observations would lead you to question the vaccine. The way it was introduced and rolled out didn't feel safe to you.
Safe is not a word I would use to describe my interactions with the healthcare system.
It must be very hard to feel that way. Nobody wants to feel unsafe, particularly when they need care. I want you to know that it's important to me to try to help this be a safe conversation for you.
I appreciate that. I know you probably mean well, but listen, it's different for our community. You should understand something about what it's like to be experimented on, to see people be taken advantage of when you need them and left out when you don't.
You have seen a lot of members of our community treated unfairly by the healthcare system. That's painful for you.
Yes, it is. Like I said, I appreciate the care you all provide. I really do. I wish we didn't need it. The less time I spend in the healthcare system, the better. You might mean well, but you are part of it. You are contributing to a system that takes advantage of people, whether you know it or not.
Motivational interviewing helps us identify and work with ambivalence to change. Sometimes that ambivalence is expressed in the form of frustration or anger toward the interviewer. These are challenging emotions to navigate. We use the term discord in MI because it emphasizes the need for the interviewer and the interviewee to be better aligned in these moments. We introduced the concepts of change and sustain talk in the second interview in this series. Discord is different from sustain talk. Sustain talk focuses on the individual's own reasons for resisting changes. Discord focuses on their perception of their relationship with the interviewer. Put differently, if you're the interviewer, sustain talk is about them, and discord is about you. Monica's last remarks went past concerns about change to express concerns about the interviewer. You might mean well, but you're part of it, she said. You are contributing to a system that takes advantage of people, whether you know it or not. MI teaches us that disagreeing with or pushing back against discord is one of the least helpful things we can do. Our goal as interviewers is to get back on the same page with the interviewee. Reflections can help us accomplish this in many cases. We can use a simple reflection to acknowledge and confirm the interviewee's feelings, or a complex reflection in cases where the discord is related to something else that the interviewee has offered. Emphasizing autonomy can be helpful in instances where there is a specific decision being discussed. For example, if someone tells you, "You can't make me take this vaccine," it could be very effective to reply by emphasizing autonomy. "You're right. It's your decision whether you accept this vaccine. I'm here to help you make the best decision for you." A straightforward apology can be helpful if the source of the discord is something that the interviewer has stated as part of a reflection. For example, someone may reply to a reflection by saying, "You don't understand me at all." An apology is a great place to start in this case. "I'm sorry, I clearly misunderstood what you were trying to tell me." In our case, the interviewer is going to reply to Monica's comments with a simple reflection and affirmation, followed by a statement to emphasize autonomy. Let's see how this impacts the conversation.
I think I understand more about why this is a difficult conversation for you. You're right that I don't know what it's like to be treated in the way you have described by the healthcare system. I know that can't be an easy thing to share, and I appreciate you sharing it with me.
No, it's not.
I want you to feel safe in this conversation, and I want the best for your mother. That means helping you make an informed decision about what is best for her, whether that involves accepting vaccination or not.
And you would like to inform my decision, of course.
It's important to me to do what I can to speak to the concerns that you have and help you make that decision. You mentioned earlier that the way the vaccine was rolled out bothered you. Can you tell me a bit more about that?
Like I said, it came out of nowhere, and then it was everywhere. I don't know precisely how long it took to develop a polio vaccine or flu vaccine or whatever, but I know it took a lot longer than this. There is just no way that anyone got to test this vaccine in that length of time. They tested it on us. They still are.
You don't feel like we learned everything we needed to about the vaccine safety before it was released?
I think people learned what they wanted to know, which is that there was an opportunity to make money, plain and simple. The only thing that has changed is that we have gotten better and faster at making money off these things. If we had a pharmaceutical industry 100 years ago, like we do now, I am sure they would have been out in the Black community asking us to put who knows what in our arms just as quick.
You felt like you were being pressured into accepting the COVID vaccine and that others in your community had a similar experience.
Oh, well, I certainly know that's the case. Nobody was there to answer questions. and I'm not sure they would have known how to answer them, even if they had been. They were there to get as many shots into as many arms as they could as quickly as possible.
You haven't felt like anyone took the time to provide you with information you need to understand whether the COVID vaccine is safe.
I don't think informing us was anyone's priority.
It's hard not to have the information you need to understand if this vaccine is safe, particularly when you're considering what's best for your mother.
It is. She can't make these decisions for herself anymore, so we need to do what's best for her.
You have shared concerns about the development and safety of the vaccine, and you have shared concerns about whether the vaccine is being distributed fairly and equitably.
That's right.
I have a lot of conversations to help people make sense of all the information that is out there on COVID vaccines. Concerns about safety and equity are often part of those conversations. Would it be okay if I share some of those resources that have helped me speak to these kinds of concerns?
It is important to be able to share information in a conversation. It's even more important to know that this information is likely to be received and considered. Motivational interviewing helps us maximize the chances that information is received by using questions before and after providing information. This format is commonly known as ask, offer, ask, or elicit, provide, elicit. The interviewer just asked an opening question in an ask, offer, ask format. Would it be okay if I share some of the resources that have helped me speak to these kinds of concerns? This question helps the interviewer accomplish several aims in a conversation. It emphasizes that the interviewer is listening first, then sharing. It helps the interviewer avoid sharing information the interviewee already knows. It also helps the interviewer understand if the interviewee is willing to hear the information they have to share. In the case that the interviewee is willing to listen, the closing question in an ask, offer, ask format helps the interviewer to know if the information was received in the way they intended, or how the interviewee feels about it. This can be as simple as, what do you think about that? Asking another question also passes control back to the interviewee, who will ultimately have to make the decision about whether they change. Sometimes the interviewee is clear that they are not willing to hear the information you have to offer. Knowing this helps the interviewer take a step back and reassess, or perhaps offer information in a different way. This is the scenario that is about to play out in our interview.
I get that you have your talking points down. I do not have the time or energy for this right now, to be honest with you.
I understand. It's a lot to ask for you to receive all of that in one conversation. If I email some links and resources for you to review on your own time, would you be open to reviewing them?
Yes, I could take the time to review what you have to share. I don't think it's very likely you are going to change all of our minds on this, though.
My only goal is to make sure that you and your family are 100% confident that you are making the best decision you can for your mother. Her health is our shared priority.
Yes, it is.
I understand that it's hard for you to trust in the healthcare system, and I also know that you've put a lot of trust in us to help care for your mother. That means a lot to me.
I appreciate that, and I know that she needs to be here. I wish she didn't. She would be happier at home. She lets me know that, but we just can't give her everything that she needs on a daily basis. That last fall she had opened our eyes to the fact that we needed more help.
You wish you were able to care for your mother full time at home, and you recognize that it's not the best decision for her health.
I do. She has been the center of our family for so long. It is hard not to have her at home, and to know that she probably isn't coming back, to be honest.
It would be wonderful if she reached a point where she could return home, and you know that might not happen.
No. So we will do the best we can for her while she is here.
That's what we want for her, to be as happy and healthy as possible.
Yes.
I want to be respectful of your time today. We've touched on a lot of important concerns regarding vaccination, and I promised that I would share some additional information with you. I can follow up with you tomorrow if that's okay.
That would be fine.
Great. I'll include a resource on how the vaccine was able to be developed so quickly, some information on vaccine safety, and some resources that have been helpful to others who share your concerns about equity and fairness.
Summary statements play an important role in any MI-informed conversation. Summaries are essentially a type of complex reflection where multiple statements from the interviewee are shared back at the same time. Summaries can be used in the middle of a conversation to check the interviewer's understanding, particularly if the interviewee has had a lot to share. They can also be used to help an interviewer focus the conversation on a specific theme from the interviewee's comments. Often, summaries are used toward the end of a conversation to transition to a discussion of next steps. They help the interviewer to ensure that there's a shared understanding of what comes next. Deciding when to conclude a conversation requires the interviewer to make a judgment based on what they've heard so far. In this case, the interviewer has decided that they've made sufficient progress and that extending the conversation might jeopardize that. Monica has multiple concerns about vaccination. Her concerns about fairness and equity have particularly deep roots in the relationships between marginalized communities and the healthcare system. It's highly doubtful that Monica would rethink her opinion on vaccination wholesale in one conversation. Her responses have reinforced this, particularly her refusal to hear the information that the interviewer offered. Monica may be running low on patience as well. She told the interviewer directly, "I don't have the time and energy for this right now." This summary statement provided the interviewer with an opportunity to reinforce their accountability to Monica, as well as her autonomy in making a decision regarding her mother's vaccination. Let's see how Monica responds.
That all sounds fine.
Are there any other questions that you have for me today?
No, I do appreciate that you aren't trying to push this on me as hard as others do.
I'm here to help you make a decision, not to push anything on you. It helps me to hear your concerns. I know it's not easy to share everything that you've shared with me today, and I appreciate you doing so. Thank you for taking time for this conversation, Monica.
You're welcome.
We are here for you and your family, whatever you decide. I hope that we can talk again soon regarding what you and your family want for your mother's care.
Yes, we can do that.
Great. I will follow up with you tomorrow, and then perhaps we can talk again later in the month to see if you have any questions about what I shared. I'll let you get back to your visit with your mother, and we will talk soon.
This was not an easy conversation for either person, but it was an important one. The interviewer might not have accomplished everything they hoped for, but they made progress. Monica said that she would be willing to receive and review information on the vaccine. This implies that she may not have ruled out the possibility of accepting vaccination for her mother. Most importantly, Monica is open to a line of communication with the interviewer that did not exist before. This is an essential step in the direction of change. This conversation was an opportunity to learn more about how MI can help us manage discord. It is hard for any interviewer to navigate a conversation when negative emotions like anger or frustration feel directed at them. MI provides us with a set of tools for recognizing these difficult moments as resources and for using them to build a foundation for positive change. We were also able to practice how to offer information and incorporate summaries into an MI-informed conversation. It is easy to gravitate toward the most severe examples when we talk about vaccine resistance. We feel that it is harmful and reductive to focus only on these cases. People are resistant to vaccination for a broad range of reasons, and we have tried to represent that in the examples in this series. With that being said, managing strong resistance is an important part of having better conversations about vaccination. There are 2 conversations remaining in this series, and they will be difficult. Our next episode will shift to a pediatric long-term care setting. It will be with the mother of a young resident who has strong opinions on the safety of vaccination, which are complicated by her child's recent experiences with the healthcare system. We'll focus on how to partner with interviewees under challenging circumstances, how to manage your reactions to extreme views, and how to draw on other resources in your facility when you can't provide everything the interviewee needs. Thank you for joining us for this episode. You can find more information on motivational interviewing and this series by clicking on the Wave button at qi.ipro.org or by visiting miforhealth.com.